I talk to people, we start bringing up dementia. A lot of people are unaware of this particular risk factor, and that is something that people very commonly take, which are anticholinergic drugs. You guys ever heard of that term before? You probably have heard what they are. They're more generic names, like Benadryl. And especially last year, there was a lot of stuff on the news about some new studies talking about the risk of anticholinergic drugs and our brain health. And people take things like Benadryl. I'm going to talk about the other drugs that are also anticholinergic, but they take it like it's like a supplement, like taking melatonin, and it's very different. And they'll take it to sleep often. Anticholinergic, so here's what the definition of what that means. They block acetylcholine receptors and weaken brain signals over time. Acetylcholine is a vital brain neurotransmitter, and it acts like your brain's spark plug. So it helps the brain neurons talk to each other. And you need it to remember things, to focus, even for muscle movement, you need acetylcholine. And in the brain, cholinergic drugs block the communication in the hippocampus and the cortex, and that affects memory and cognition. Maybe you've felt this a little bit if you've had to take Benadryl for like an allergic reaction or something, and you felt like really loopy and out of it, right? So you're getting a little bit of that effect. But what we're finding is if people take this on a regular basis for a long period of time, they're greatly increasing their chances of dementia because of the more permanent effects of taking that for long periods. So I'll walk through that.
What similar drugs are Benadryl is?
Got a slide for you. Or are you talking about
Like
alternatives
other names,
to it?
yeah.
Oh, other names for ones like Benadryl? I'll give those to you. On this one study, frequent use of these anticholinergic drugs increased the risk of developing dementia by 54%, which can even be a greater increased risk than having the quote-unquote bad genes in the family. This is another study, roles of anticholinergic drugs in dementia risk. This one, they looked at over 1.5 million subjects, and they found that anticholinergic drug use was associated with an increased risk of all-cause dementia and Alzheimer's disease. These are a list of the most common anticholinergic drugs that people may take. Because anticholinergic drugs work on acetylcholine, and that we know as we get older, generally you see a graph that acetylcholine naturally declines as we get older. It is especially risky for people over the age of 60 to be taking anticholinergic drugs on a regular basis. So if you or somebody close to you is on one of these medications, it's a good idea to talk to your doctor about the risks with dementia and to see if there are other options that could be helpful to you to not have to rely on these. The Parkinson's meds are the ones that really break my heart, because I've had patients diagnosed with Parkinson's disease, and the Parkinson's disease is really lowering their quality of life, so they go to the medications to try to stop the symptoms of it, but they live in fear because they know the drugs that they're giving for the Parkinson's disease are going to increase the dementia risk. And so which one is worse? And you're sitting there choosing, but there's not a lot of other options for them. But allergy medications like the Tylenol PM, anxiety medications like you can see them there, Visceral, bladder control if you have issues with bladder control, IBS meds, motion sickness ones, and again, it's taking it on a regular basis. There was another study where they looked at what if you just took it every day for 3 months? Could it increase your risk? And they found that taking it for 3 months or more daily increased the risk of dementia on average by an estimated 46% versus people who don't take these meds every day for 3 months. And then they did another study where they actually did MRI studies of the brain on people who had been taking anticholinergic drugs, and they found the use of those medications was associated with an increased brain atrophy, which is like the wasting away of the tissue, and dysfunction and clinical decline. Thus, the use of anticholinergic medications among older adults should likely be discouraged if alternative therapies are available. So it's actually shrinking the brain tissue. Now look, if you're having an allergic reaction and your throat is closing up and you have a Benadryl at home, I'm not saying don't do that, but just to use caution with every medication, because that effect on the brain, that drug is doing exactly what it's designed to do, right? And I try to not say things like side effects, because in my opinion, they're just effects. And there's effects that eventually add up and you become very aware of them. Every drug has risks to it, and that's why we want to do everything possible to avoid you being in a situation where you have to take one, and then use caution when you do. And if there's alternatives that can work better, look to those and talk to your doctor if you find that those are something that you take regularly. There are some tests that you can do to look for either way early onsets of mental decline, or to see if you're at greater risk of dementia as you get older. And that happens to be the grip strength test as well as a walking pace test. So instead of waiting for the other shoe to drop, these are some ways that you can look into the future. Across multiple high-quality studies, they showed that slow walking pace was the equivalent to a 50 to 90% higher risk of dementia. It is one of the strongest physical vital signs of brain aging. So if maybe you've had a parent where suddenly you're like, she used to always keep up with me, and now I'm having to go very slow so that she can keep up with me. When you see that rapid decline in walking pace, it's not a good sign for brain health. It often changes years before cognitive symptoms start to develop.
A question about that with the walking pace. Is that if there no physical cause for it, like a neuropathy or something like that prevents it? Okay.
They did not equate the fact if you had like a limitation, like you have arthritis in your ankles and that slows you down. They did not in the studies equate that to increasing the chances you have dementia. More that the slower walking pace is some of the earliest signs that dementia is starting to happen, years before the actual cognitive decline can be the slowness in your walking. However, it's really interesting because a lot of the things that would keep your walking pace up, like staying physically fit and exercising and walking daily, will help your brain health, your vascular health, all the things that also help to temper the dementia risk will help you with your walking pace, and then ideally you would not see that decline in your pace. But it's just an interesting thing to look at there. Some of the lead mechanisms they said is because walking speed depends on our frontal lobe for executive function, our basal ganglia in the brain for motor planning, our cerebellum for coordination, and then early neurodegeneration affects these systems, and it leads to the slower gait. And also slow gait is strongly associated with small vessel disease and white matter hyperintensities that are these bright spots on MRIs that we can see of the brain, and they're signs of an aging brain. And those are linked with dementia risk. So if you're not able to keep up, it could be because you've got some blood vessel issues also, and just another reason for really staying as fit and having healthy blood vessels as possible.
What test diagnoses that? You said white.
That's an MRI of the brain. There's some key things you can see on MRIs of the brain that will alert if there's dementia. There's also, they can do a test of your cerebral spinal fluid at the lumbar spine that also can be diagnosis for specifically Alzheimer's. Those are like the main things that they'll do. And then they'll look for all the signs and symptoms. A lot of you, did anyone not test their grip strength here in the office? A couple of you? You can do that when you're done. I think it's kind of fun to see where you're at. So we have the dynamometer where you can test your grip strength. And then we have our categories of strength based on your age and your decade. And what they found in this study, and this has been done a few different times. One particular one was researchers showed that people who had the lowest quartile, meaning they were in that lowest 25 percentile for their age group with their grip strength, they were up to 72% more likely to develop dementia later on in life when they tested them in middle age. Which I didn't know this, but according to the researchers, middle age was age 40 to 56. So if you're 55, you're still middle age. I guess it's like 60 is when you get out of middle age. But yes, if you're in that lowest percentile, there's a 72% increased risk of developing dementia. And the reason why they correlate these things is they say grip strength is a good proxy for overall body strength. So if your body's strong, generally your hand grip strength is going to be strong. You had to do a bunch of work to be strong enough, to have good strength in your grip. And then that actually helps protect your brain. All the exercising and lifting and things you did that developed that good grip strength also help to protect the brain. A weaker muscle strength is correlated with smaller brain volumes, especially in the hippocampus, which is a region critical for memory and heavily affected by Alzheimer's disease. And then weaker hand grip strength can be an early indicator of brain health, especially if you see a rapid decline, where I did have really good grip strength and now all of a sudden I can't grip anything. It could be early signs of issues with brain health. And so what does that tell us about one of our 5 essentials? Is that exercise. Stay on a regimen of exercise and move your body always. There's no getting around the need for our body to move and to maintain muscle mass, especially as we get older. Very important. And I think some of the best muscles to keep working on also are our leg muscles. Your ability to do squats, get up off the floor by yourself is really important. Don't let that slip. I've seen a lot of people in my life where they suddenly have like a decline, right? They totally stop working out and stop taking care of themselves, or life gets crazy and then they never get it back. So if you find yourself not being able to do something that you did before, make that a mission over the next couple months that you're going to see improvement in that, because you really can. You can change that if you keep working on that. If getting off the floor is difficult for you, and I know some people have knee issues and that prevents them, but if you've just lost the ability because your muscles aren't strong enough to get off the floor by yourself, make it a mission to keep working on those muscles to be able to do it.